Hello, I'm Dr. James Bogash, expert in health and longevity and creator of Bogash Life in Balance. And today we're going to talk about a very interesting study out of the UK looking at specifically response to vaccination, symptoms after vaccination versus unvaccinated using the mobile app for COVID that's available in the UK. A couple things this study was that it was not looking at effectiveness in cases of vaccination. So vaccination was lowered the risk of getting COVID versus this. That was not part of this study. These are people who were vaccinated, had COVID, and they were then matched to people that were unvaccinated and had COVID. So really a lot of data to tease through in this study. And to sum it up, the authors did a really great job of kind of piecing everything out, and there were quite a few study groups in there and quite a few charts and things to look at. But and they broke everything out. So if I give numbers, it's a little bit more challenging because there were so many numbers based on age and whether it was 7 days after the last vaccine or 14 days after the second. I mean, it was quite a bit. I'm sorry, 14 after the first or 7 after the second. But it was very clear that there was a decrease in hospitalization in the vaccinated group, in the 5 or more symptoms in the vaccinated group versus the unvaccinated group. And 5 or more symptoms at the early onset is a sign of you're going to have a lot more problems with COVID versus just 1 or 2 or 3 symptoms. The more symptoms you had, the more problems COVID's going to be. So it was very clear that it helped with those. 2 interesting points of this study, and the first one is that the people who are vaccinated were more likely to be asymptomatic. So that's great, less symptoms, but if you are in the camp that believes that asymptomatic spread is how this has become such a demon, and that who walks by somebody in a grocery store and they could unknowingly kill your grandmother, is what the story has been. And certainly the evidence that I've looked to in the studies I've looked to suggests that asymptomatic and even pre-symptomatic spread is a pretty small spread, even in the household, let alone in the community. But if you believe that asymptomatic spread is a thing, and the authors even suggest that we should be testing the vaccinated people just as much as the unvaccinated, and we damn well know that that's not happening. Perfect example is the Carnival Vista cruise leaving out of Galveston, Texas, where a 77-year-old woman turns out tested positive, later died. 26 people, or 26 crew members were sick or tested positive as well. But this just goes to show that this isn't about the science. This is about making people feel more comfortable with being vaccinated, even though they may be just as contagious, and in this case, they should be tested just as much as the unvaccinated crowd. And again, even the authors suggest that that's the case, but we know that that's not happening. It is, here in the United States, we're definitely moving towards either, vaccinated or negative test, and yet this study just yet again confirms that even the vaccinated are more likely to be asymptomatic, and if you believe that the asymptomatic is a part of the spread, they should be more frequently tested than the unvaccinated, and that is absolutely not happening. The other thing that this study really people took it as being a marker that vaccinated people were less likely to experience long COVID. And I have not done anything on long COVID. I'm not a long COVID disbeliever, but I certainly have my questions on it. I think once you rule out PTSD, gut microbiome disturbances, and immune disturbances, you pretty much have really need to do a separate video on this. I just feel that this is just a continuation of people whose immune systems were really off kilter, and as a result of COVID, it threw it into whack. I personally only know one person, patient or otherwise, that has dealt with long COVID that was otherwise very healthy. It took quite a few months for this person to get rid of all the symptoms, fatigue being a big one, but ultimately she recovered and is doing relatively well. But this study looked at people who had symptoms after 28 days, and they were about, again, there was a lot of breakouts in this, but it was generally about a 1% lower chance of having symptoms after 28 days if you were vaccinated versus unvaccinated. Not a huge difference, and 28 days is not long COVID. 28 days is a typical viral response, and if your immune system is not up to snuff, it's going to take even longer for you to recover from that. And it just blows my mind that we think that in children, even 2 weeks or 28 days, if they still have symptoms, it's long COVID. It is not. It's a typical body's response to a viral infection. A lot of it has to do with underlying health and your immune balance. And if something like an infection kicks it off kilter, whether it was COVID or influenza or Epstein-Barr or any other infection, this is not a new scenario. It has always happened with people that were off kilter. And so looking at this study and saying that it proves that vaccination lowers the progression to long COVID, open discussion, but 28 days, more than 28 days isn't long COVID to me, and it was about a 1% difference. Again, you can look at the tables in the study, but it wasn't a huge difference in the vaccinated from the unvaccinated crowd. As always, I'll post a link to this particular study in the description. And again, it's a very good study, very well broken out, and a lot of data to go through, some wonderful tables, but be prepared to sit down with a cup of coffee and spend some time on it. Make sure you like this video, share it with somebody who you think needs the information, and subscribe to the channel.